Are you tired of eating lunch at your desk, staying after hours in the clinic, or working from home to complete your progress notes? Documentation is the main cause of physician burnout. Discover a simple fix to take back control of your time and enjoy practicing medicine again. Simplify medical documentation and have a meaningful interaction with your patients. Get home early from work and focus on what really matters. Chartnote AI Scribe turns your speech into structured notes in seconds. Fast, accurate, multilingual, and seamlessly integrated with your EHR. AI Scribe listens, understands, and writes your notes in real time. Chartnote has everything you need to expedite your medical documentation. Chartnote, revolutionizing medical documentation with AI.
Welcome, everyone, and thanks for joining us for Chart and Chill Urgent Care Edition. My name is Gerardo. I'm the founder and CEO of Chartnote. Today, we're joined by two leaders from First Choice Urgent Care, Dr. Ali Hassan and Ali Ayoub. Dr. Hassan is the CEO and founder of First Choice Urgent Care. He's a physician entrepreneur who has built a high-performing urgent care organization known for innovation, efficiency, and a strong commitment to patient-centered care. Dr. Hassan brings deep frontline experience in acute care and a leadership perspective on how technology and modern clinical workflows can streamline operations and reduce clinician burnout. Ali is the Director of Operations at First Choice Urgent Care, where he oversees clinical workflow optimization, team leadership, and day-to-day operational excellence across the organization. With experience both as a clinician and operational leaders, he has a unique understanding of how workflow design, staffing, and documentation tools impact care delivery and efficiency. His work focuses on improving throughput while supporting clinicians and enhancing patient experience. We'll be talking about how modern documentation workflows and AI tools like AI Scribe are reshaping urgent care, reducing after-hours charting, and helping teams stay efficient without burning out. Throughout our webinar, if you have any questions, there's Q&A at the end of the session, but feel free to put the questions in the chat and we'll address them as they come in. So let's have in Dr. Hassan. Ali, thank you so much for being here today. I wanted to start with the origin story of First Choice Urgent Care. So Dr. Hassan, what inspired you to build it?
Well, it's a long story, many years in the making. So I'm an ER physician. I've always been into some leadership position with the emergency department and always looked at throughputs and looked at efficient systems and looked at really providing quick access to patients and good care to patients. So urgent care just fit right in for me. And urgent care today is very different from when I started 15, 16 years ago. And patient access and communities really understanding what urgent care is in our health system today is very different as well than 15, 16 years ago. Now it's part of everybody's life. And obviously you've seen the growth of urgent care clinics quite a bit in the last decade. And I think it continues on an upward trajectory. So part of running urgent cares and making sure you have an efficient system and scaling is it's all about people and about efficiency and making sure that the people that are doing the day-to-day stuff are able to do their jobs easier. I think for me as an owner, I take pride in making sure I look at systems. I don't just sit in an office and just make changes that affects people on the ground. And I'm in it. I am in the midst of seeing patients. I'm in the midst
Oh, wow.
of looking at systems and processes just to make sure that we have an efficient system and throughput. So from that sense, and from what we've seen over the last maybe decade or two, documentation is a big piece of what we do. And the when you look at what's happened in healthcare, I think there's been more and more time spent away from the patient and spent on documentation, which is why us utilizing tools that is available today, like Chartnote, has been extremely helpful for us.
Yeah, I mean, I was gonna say, I mean, urgent care, there's a huge need. I mean, sometimes you don't want the low acute cases in the ER, and then at the same time you want access that you don't see in the clinic, sometimes like after hours, or when you need like same day appointments. So I think that's what's fueling the need for urgent cares. And then you mentioned documentation has been a challenge, but besides documentation, what other operational pain points in urgent care do you face right now?
Well, getting paid. Getting paid, but that's a problem everywhere in healthcare, you know. I think insurance companies now they're in the business of not paying. Um, so it's interesting that the middleman between you and the patient is who's controlling the whole flow of the commerce or the economics of providing healthcare. And for us, it's a challenge. You know, we have some centers that are 24-hour operation, and the cost of providing healthcare has gone up tremendously. You know, look at inflation alone. You know, you buy a gallon of milk today is different than 10 years ago, yet reimbursement rates haven't gone up much. You know, we
Yeah.
still, on some of our contracts, get paid what we got paid 10 years ago and 15 years ago, which is mind boggling to me. And, you know, I can spend hours talking about insurance companies and the pain points. So, you know, collecting a dollar from an insurance company, you have to spend so much money to collect that dollar. By the time it comes to you, you're lucky if it's 40 cents.
Oh.
Um, so it's they've really made it challenging and made it
So
very
40
difficult. And
cents after all the time and effort you spent trying to collect.
well, this is you collecting. You haven't paid for anything yet. Your
Oh, okay.
expenses.
So you're charging a dollar and you get 40 cents.
Yeah, sometimes you're getting
Oh,
40, 50 cents on the dollar when you bill it. So your charges, this is what you're getting reimbursed. And now out of that 50 cents that you collected, now you got to pay the manager, you got to pay for the EMR, you got to pay the owners of Chartnote, and you know, so
you have to get
there
Ali.
isn't much money that's left over. Yeah, you got to
So
pay a high performer like Ali Ayoub to run the operation.
Ali, I wanted to ask you, so you oversee operations. What does a typical day look like across your clinics?
There's a lot that goes into doing all these things that Dr. Hassan talked about. It's about all the checks and balances, making sure that, our teams are huddling and making sure that we are, doing all the things that Dr. Hassan talked about and making sure that we're providing that cost-effective, efficient care. We talked about some of the pain points and the challenges in the market that we're in right now. There's an urgent care in every corner, right? And it's about making sure that you're performing that high quality care and making sure that all the staff members and the teams have the resources to perform that care, and sticking to that agenda and making sure that patients are getting the best experience possible.
And what are the workflow challenges that clinicians bring to you most often?
That varies based on what types of patients that you're seeing. We have different lines of service that depends on the time of the day and, what clinic that you're working in. When we're talking about, this platform and dictation, being able to see people and spending more time with them and more patients per hour, this has been something that has made that a lot more feasible, right? Spending more time with the patient. So challenges come in, what type of volume are you seeing? Is this someone that is an urgent care patient, a workman's comp patient, a physical that you're performing, or things of that nature? And how we get them in, get them out, and get them better as quickly and as efficiently as possible.
Yeah, no, that's a great insight. I'm right now here in Dallas, Texas, at a conference for lifestyle medicine, and we just heard a keynote, and one of the key points was how this technology is allowing human connection in the clinical setting.
Absolutely.
So that's amazing to me. So let's start to talk a little bit about documentation. So how much of a burden has charting been for your providers?
So, like I said, depending on the volume that you're seeing and things like that, I'm someone who wears a couple different hats, right? So I am working in a busier clinic, but I'm also focusing on scheduling, and I'm focusing on operations and some of the things that you talked about. And all of those things that I'm doing, the biggest stress that I was finding was making sure that I was charting in a timely fashion, and making sure that I can put out a fire if needed and do different things like that. This has completely eliminated the dictation stress for me. My focus can be put on making sure that I take care of the patients, addressing areas where we can, improve, like our weaknesses that are going on, building on the strengths that we have as a clinic. And this is my biggest stress of everything that I've been doing in terms of the operation and as a clinician prior to adopting Chartnote was dictation. And this has completely eliminated that for me. I don't have to think about, wait, when did they say that started? Or what did I say I was going to prescribe this particular patient? Because sometimes they'll jumble in, especially when you're seeing a few different patients at the same time.
Yeah, I've been there.
Yeah, for sure. So being able to focus on them and with accuracy and with precision has eliminated all of that stress for me. And that's made me very appreciative of being able to do what I can do at an efficient level and at a high level.
Yeah, I remember when I was in residency, one of the attendings was their tip for efficiency was to dictate in front of the patient, which is a little bit awkward, like dictating medical lingo, and then sometimes you couldn't do it, and then you try to do it after you see the patient, but then you have the other patient waiting for you, and you do it at the end of the day or lunchtime if you're lucky, and you forget half of it. So with AI, it's just listening. And so before using AI for documentation, like how many hours were your clinicians spending after hours on documentation? Do you have any rough idea?
Were you speaking during the COVID surge or after the COVID surge? I remember there were times where I was spending countless hours doing it, right? And there was a time where I was doing, 58 clinical hours a week at that time. And, the patients added up. And I mean, some weeks it could take me up to 30 or 40 additional hours, depending on the acuity of cases and the volume. And then, other times it would be just a couple hours extra a week. But definitely since the adoption of this, it's been significantly less, if any, after work.
Yeah,
So I'll tell you, Ali is probably more clinical than I am these days, and I tend to be more on the admin side. And I can tell you, when I speak to providers, when I go around the clinics and I talk to providers, and obviously with Chartnote or without Chartnote, different providers have different their efficiency is different, right? You have your best performers and you have your underperformers. And for me, I always say you're as strong as the weakest link in your team. And when I go to those people and I say things like, hey, how are things going and how's documentation going? And when I hear things like, the best thing that ever happened to me was Chartnote, or the best thing was ever happened to me was AI, and I just love it. It just like takes away, it brings me so much more job satisfaction. And to me, that says a lot. On the other side of things, when I look at performance in terms of generating revenue, right? At the end of the day, the goal is see a patient, close a chart, create a claim, and send it out. When that time, you can cut down on that time, it really helps your cash flow and it helps your bottom line. And
Yeah,
I see
that's
it today more than ever. I actually I was in a billing meeting this morning, and we're talking about one of the questions. One of the billers asked me. We use a third-party billing company, and they asked me. They said, it's interesting when you look at the time that this provider is spending on a chart versus this provider, and one of them was like around 3 minutes per chart, and the other one was at 15.5 minutes per chart. And they said, what do you think is going on here? Is this provider just not as efficient? I said, no, this provider uses AI and this provider does not. It's interesting. It
wow.
was a quick answer and I could see it. I could tell exactly. And that person that was at 3 minutes was seeing a lot more patients as well.
So, when did you first start thinking about using AI to solve these workflow problems?
Well, I think we were in a conference and we met you and we met other AI vendors. It hasn't been that long. It was it April?
In May, it was in May, I
May?
believe.
Yeah, it was in May of this year when you we met you and you said, "Hey, let me just show you real quick." And you showed it to us. We were both impressed with it and wanted to give it a shot and tried it. Obviously, there's a cost with everything that you do as well. For me as a business owner and we have multiple locations, you have to look at return on investment, right? And whether or not we're going to spend the money versus our provider spending the money. And that's where it gets challenging as well. As we're urgent care, we're a very low revenue per case in terms of reimbursement, so we need volume. And the margins are so tight that you have to think about, even if it's something as $70 a month, but you multiply it by 30 providers, all of a sudden is a huge number. If something is $100 and so forth. So I have to think about those things because the margins are that tight in urgent care space. So one of the things that we did was because we provide CME to our staff, we said we're going to approve this as a CME reimbursable cost. Just until we evaluate this further and see whether or not it makes sense as a company to pay for this and whether or not it makes sense on return on investment. I have no doubt in my mind that it makes sense, especially when I look at the amount of time it takes to create a claim and amount of time it takes to close a chart and amount of time that now our days in the AR has shrunk. But obviously I need more data. We just been doing this now for 5-6 months, so as we incorporate more AI into our workflow, that's my goal as an operator, looking at the numbers and trying to see whether or not it's worth that money spent. I see it, I think it's there, but I like to look at numbers just to say, yep, this makes perfect sense, and the money saving
So,
is
Dr. Hassan,
definitely
I
there.
think we lost you for a second, but I wanted to ask you, Ali, from the operation sides, obviously, besides helping you with billing and time savings, what other criteria matter to you when you were evaluating other AI scribes?
So ease of use for sure, right? Customization has been very important. Being able to customize this to what fits our needs in our system has been super helpful. your support. You guys have been super helpful in terms of support and getting things together. And employee satisfaction, right? And the beauty of this is we have some providers that have been practicing for over 30 years, and some that are brand new, and they both have that similar thing to say about it. Some of our more seasoned providers say they feel like they're 16 in a sports car again. And they come from the days of paper charting, right?
Yeah.
And they said, if this ever goes away, like, I don't know what I'm going to do, because, they've been through, paper charting, and, there's always been things like dot phrases, and then, other platforms that people have used. But the ease of use, the customization, and our employee satisfaction for those that use it is super high.
Yeah, no, it's very rewarding to hear users when they say, I was about to retire, but now, I mean, using this, I'm able to go home on time and enjoy life. So it's nice. So I wanted to talk a little bit about your rollout in your organization. How did you introduce the tool to your clinicians, and how did it look, the adoption during the first couple of weeks?
So the reaction never got old. So what we did was I used some of the media that you guys have on your socials and on your YouTube page, and I kind of emailed it out to all of our providers, and I sent it out step by step with the way to get it set up. Setting it up on the phone, downloading the app, going to chartnote.com, registering it, setting up the template, you're ready to roll. It's a 5 to 10 minute setup up front that's going to save you all this time going forward, with an explanation of how to do it. And then for some people that requested it in person, downloaded the app with them, showed them how to do it, talked about the difference between voice chart and AI scribe. And as soon as they grasped it, they did not want to let it go. And it was something that was easy to pick up. So to answer your question, it was the initial electronic rollout, and then we did some face-to-face for people that needed it, but not everybody needed that. And they hit the ground running.
Dr. Hassan, was there anything positive or negative that surprised you during the implementation?
So I'll tell you, again, Ali probably deals more with the implementation in terms of getting people on board and introducing Chartnote. But for me, I can give you specific examples where I walk in, like, 2 months or 3 months after Ali has sent out an email and encouraging people to try it. And I said, hey, have you tried this yet? And they're like, no, I really, I feel like I'm good with what I'm doing because I use a lot of the macros, and we use Athena Health. So I use a lot of the macros. I said, listen, I am telling you, this is a great thing. Try it out. They're not charging you. Try this out. If it doesn't work for you, don't use it. But if it doesn't, just try it out, because everybody that I have or that has been on it, we haven't had anybody say, you know what, I hate it, right? I've had maybe one or two people tell me that, um, there are sometimes there might be mistakes that come up, and so they would rather not use it. Now they work at a clinic that's not as busy, so they have all the time in the world as well. So that plays a factor. But the few people that I have gone up to and said, listen, do me a favor, try it out. And one time I told the provider, I said, listen, there's a patient right now to be seen, right? You don't even have to download the program. Look, I have it on mine. Let me turn it on. And I said, walk in with my phone, try it out, come out. Let's see how quickly this gets done. And she was just taken back by it, right? She walked in, came out, everything worked seamlessly. And she's like, oh my God, I can't believe that it took out everything that the mom was saying and it put everything else in the dictation. So she was really excited about it, and she started using it. And now every time I go, she's like, "Oh my God, this is the best thing that ever happened to me."
Yeah, I mean, one of the things that you want to do is just, do a brief proofreading of the note, right? Because at the
For
end of the
sure.
day, the clinician is the one signing that note. But I wanted to touch a little bit about the patient reactions. What, how did you notice anything in the patients? Any resistance or any change in how they perceive the satisfaction scores or the interaction with the physicians?
You know, what's interesting is some people laugh. So I walk in and I say, "Hey, I'm using AI as my scribe. You know, do you consent for me to use?" And they, I'm just going to take a step back to Dr. Hassan's point. You know, there's different kinds of people in today's world, and everything moves so fast. Some people are so gung ho and excited about AI and these different technologies, and some people are super reserved. And it's at both ends of the spectrum talking about age and experience. And I, admittedly, I'm always into now, trying different things and improving and things like that. I just got so comfortable at what I used to do that I even had a little bit of hesitancy when I met you and you showed me. And, the most interesting thing to me is that initial resistance for people. I talk to people about this and I'm like, just trust me and just download this thing. So there's that hesitancy. That also comes from the patient's point of view in some cases. They're like, wait, what? Are they recording everything that I say? And then I have to explain, well, when a provider sees you, we have medical documentation that gets submitted to your insurance, and no one's ever resisted. But there's the initial, like, taken aback. Everybody has consented. I've never had anybody decline it. But what I have found to be very nice and rewarding is people view us as a top notch, ahead of the game, people that are investing in their clinics. I've had some feedback like, wow, you guys are really ahead of the game. You guys are utilizing technology to make your job. And it looks like you're up to date with everything that you're doing and things like that. So that's some positive feedback. Um, so it's worked out really well, and it's actually people do think that we're up to date in advancements and using technology to support our practice.
So, Dr. Hassan, from clinician leadership perspective, how do you ensure that the AI generated notes maintain the quality and patient safety? And maybe at least more involved in this, but is there anything that you're doing to make sure that it's not affecting patient care
So
negatively?
we have, even without AI, we have an internal audit that we do, an internal review, and that gets done probably a lot more rigorously than a lot of systems. And what we do is we have a couple of providers that are part of our leadership team. The actual review charts from a billing standpoint to make sure we're compliant, from ordering stuff, making sure that when they're ordering something, the order is physically going into the chart. From a documentation standpoint, that they're giving adequate follow up to a patient. We do a lot of occupational health as well. I know we're talking about first choice urgent care, but we have another sister company called Ahmed Connect, and we do a lot of occupational health and we do workers' comp. So we utilize it for that as well. And it's important to capture specific information in workers' comp, and important to give them good follow-up information. Especially when the employer needs to know exactly what the restrictions are and so forth. And what I like about this is sometimes when I'm in the room with the patient, talking to the patient, it's actually taking down everything that I'm saying to the patient in terms of what their work restrictions are, and it's putting it for me in a good, nice, um, clear instructions for the employer to follow. Um, so going back to your question, what do we do internally? We internally audit a lot of charts, and if we bring on somebody new, a new provider, obviously we're putting them their charts again more rigorously reviewed. But we do it even for existing providers. We have charts for Ali Ayoub getting reviewed, and sometimes he gets feedback. Hey, on this chart you missed 1, 2, and 3, or in this chart you missed this. And one of the things that you see is the AI also help you capture things that previously you may have left out of the dictation. So from that standpoint, it's nice um, to fill in the blanks and things that you normally, if you're typing, you're more likely to leave a lot of information that gets said during the
Yeah,
visit,
yeah.
and that gets captured in. I gotta say, it's good and bad, right? It's good and bad. I think definitely there's definitely more good than bad, because sometimes you say things you're like, I don't know if I wanted this in the chart. Um, this is coming from an ER physician.
Yeah, it's definitely important to double check.
Review.
And
Yeah, make sure you read your
yeah,
chart. You know.
Ali, you mentioned about consent. And so I want to ask if you have implemented any guidelines or steps for best practices around using AI for documentation.
Well, so it's exactly that, making sure that you're obtaining consent. And you never want, and you want to be clear, and you never want the patient to interpret, so this is you using AI for your clinical decision making and making sure that people understand that. Sometimes patients hear AI. I can tell you 1 out of every 10 patients, well, I'm not going to say 1 out of every 10, it's probably a lot more than that. Quite a few patients come in and say, you're obtaining their history and they're, performing a physical, and they say, well, I looked it up on ChatGPT and this is what it told me I have. And, making sure I tell my providers, to make sure that you specify that you are using this as a scribe and it's not substituting clinical decision making.
Yeah, that's very
And
important.
sometimes that's the hesitancy with some of the patients as well. And I say, as a matter of fact, I set my phone down after I get the consent and I put it there, and then I turn my body and I face the patient directly, so they know I'm not chat GPTing, hey, they have, chest pain for 3 days. What are my differentials here, kind of thing. So just giving a clear explanation, making sure you obtain that consent, making sure that you're on the same page with the patient, I think is important.
And I don't see anywhere as many patients as Ali sees. I'm more on the admin side and very minimal clinical. Um, but I will tell you, the patients I have seen, I just walk in and I say, if it's okay with you, my phone is going to listen to our conversations and start typing out my note, my chart. It's going to start filling up my note, my medical note. I've never had any like anybody. I don't use the word AI personally myself. I just physically just say, if it's okay with you, my phone is going to be typing out our conversation so that when I step out, my medical note will be nearly complete. That's all I
Yeah,
say. I haven't had really any resistance. I'm sure, obviously, if I saw as many patients as he does, at some point you're going to come across the people that are reluctant or thinking like Big Brother's always listening to me and why you taking, there are those people that no matter what, they're always suspicious of what's happening, right?
yeah. I want to touch a little bit about the future and wanted to ask you, where do you see these documentation tools and AI tools? Where do you want them to evolve so they can continue to help urgent care? And what would you love to see our tool to do next?
What I would love to see is, I'm sure that this, I know that this is EMR specific, but I would love to see diagnoses be auto-generated in there, so I don't have to search them up. That would be fantastic. Putting in medications as well, I think would also be fantastic. It's already doing a great job with accuracy, obtaining the information, recommending ENMs and CPT codes, so billing is already involved. But where I see it being super helpful is just plugging those in there. And I think that would save even more time and be a lot more convenient as well.
I
Yeah,
think for me, the billing side more than anything. I like to see more accurate diagnosis. Sometimes I see what the CPT code is, and it'll give me a description. But I'll take that CPT code, I'll copy it and pop it into our EMR, and I'll get a different diagnosis than what it says. And I think that piece of it, with a better accuracy, I think will be extremely helpful in terms of billing. My biggest thing with our providers is, we talked about payers, and payers are in the business of not paying. And if I was hoping it has helped us, but I think if that part of the AI tool gets better, I think we're going to be able to defend our charts better, because it's not uncommon that we get, more and more. It's just so painful that our billing team will get these charts that need to be reviewed for. Um, they want to make sure that the medical record satisfies the level of billing that you have and so forth. And it's crazy because a lot of times our providers might mention something in the medical decision making, but they don't put it as a diagnosis, and it pisses you off, right? But from that standpoint, the AI tool actually has helped because it will list multiple diagnoses, but sometimes those diagnoses are not as accurate. And I would like him to also, rather than me having to copy and paste it, I would like it to be seamless and flow in there. And then I look at and review my diagnosis, and making sure that they're accurate.
Yeah, no. Thank you for sharing this, because I'm sure right now our technical team is listening, and we're aware that we need to improve the accuracy of the diagnosis. And and definitely, I mean, we do provide the ICD-10 codes, and with the Chrome extension, you can transfer the note to the EHR. But one of the things that we need to do is to actually put each specific diagnosis not as free text, but as actual in the place where you can bill for that. I think that that improves your ROI, and so it's important that you mention it, so that helps me make my case and push for that update. And then the other thing about orders, I think that's a little bit down the road, but I mean, if you say I'm gonna order an X-ray and order aspirin, we can definitely use that context and present the order ready for you in the EHR. That's on the roadmap, and we can definitely do that. And we'll probably next year we'll be working on those kind of updates. Well, anyway, not sure if we have any questions from the audience, but Dr. Hassan and Ali, thank you so much for being with us today, and talking about your experience with our tool, and how it's like to treat patients in urgent care. And if you want to try out Chartnote, you can always just download the app, go online to chartnote.com, and start using it for free and give it a try. Any closing comments from you all?
No, I think I think it's a great tool. I think obviously there's a big move in AI with everything that we do. It's going to be part of our daily lives, and now it's part of healthcare as well. And I think I'm excited about it. I can't wait to see what the future holds. I think there's so many doors that are still not opened, and AI is going to open those doors, and hopefully it'll make medical documentation that much easier, which it's already done. But the billing side and reimbursement and the admin side, and I don't know if you can train AI to be in the insurance companies at what they do, but if somehow you can, more power to you. That's what I would like to see, because it's just so painful dealing with them. And hopefully as you guys continue to improve the systems, it just helps us more and more to do our job better.
Excellent. Well, again, thank you so much, and we'll see you around. Take care.
Take care. Bye.
So Chartnote came into my life a couple of years ago.
One of the reasons why I love Chartnote is because it has been allowing me to really collect and build a strong patient history
During my trial period, I used Chartnote both to dictate with the microphone as well as with the AI Scribe platform. These were wonderful and helped me to get my work done more efficiently, timely, and best capture my care.
There's no cost to a trial. You can see how it impacts your day-to-day practice. You can simply choose the max plan when you're ready. That's what I do since I see almost 100 patients a week.
But as soon as the AI component came into it, it's helping me to write those SOAPs much faster.
And one of the things I love about Chartnote is it allows me to focus on the patient. I don't have to constantly be staring down at my computer, taking notes, or glancing away, writing something down. I can focus on the patient, on their problems.
I want that unlimited resource. It works on any computer, any device, anything that records. It's simple to do. Any profession, medical profession, can use this.
I would absolutely recommend Chartnote to colleagues and other DPC or direct primary care clinics looking to support their staff.
I would very highly recommend this system to any clinician who's got even the smallest interest in helping out more patients while improving the quality of their own life.
We've just rolled out an important update at Chartnote to enhance your account security. Multi-factor authentication, MFA, has been enabled to strengthen your protection and meet HIPAA standards for data privacy. To continue using Chartnote, you'll need to reset your password and enable MFA the next time you sign in. Follow the steps on screen to complete your login securely. 1. Go to the login page and click Forgot Your Password. 2. Enter your email and select Reset My Password. 3. You'll receive a code by email. Copy it, return to Chartnote, and paste it in the verification field. 4. Create a new secure password and click Change Password. 5. Then set up multi-factor authentication, MFA. You can choose to receive the code via SMS or use an authenticator app such as Google Authenticator or Authy. If you choose an app, scan the QR code or enter the setup code manually. If you choose SMS, select your country, enter your phone number, and wait for the code. That's it. From the moment you complete this process, your account will be protected with multi-factor authentication. From now on, every time you sign in, you'll need to verify your identity through MFA.